Welcome to Health and Family. I'm Shay Burgess, and with me in studio today are the Minister of Health, the Honorable Kim Wilson, JP, MP, and the Director of the Department of Health, Mr. David Kendall. Our topic today is obesity and diabetes. Thank you both for being here. The 2017 speech from the throne stated that government will engage all sectors of society in a coordinated, strategic plan to halt the rise in obesity and diabetes in Bermuda. This is in response to the high levels of obesity and diabetes and other related chronic non-communicable diseases in Bermuda. This is costing Bermuda dearly, first in the poor health of growing number of Bermudians who sometimes cannot work or study as a result, and second, in real dollars, the actual cost of health care for people who are diabetic or obese. And we welcome you, Minister, to Health and Family. So we wanted to start off with you basically saying that this is a public health crisis. Can you elaborate more on this with our audience?
Yes, thank you. It's a public health crisis for a number of reasons. First and foremost, it involves every aspect and every individual within the public. At the heart of the Ministry of Health is a number of things. One is we want to ensure that we have healthy people in healthy communities. And obviously, in order to do that, we need to address certain issues and help individuals recognize that there are things that they can do to increase and improve on their health. Secondly, we need to make sure that there is affordability within our healthcare system. Healthcare costs are rising, they're unsustainable, and we need to also take steps to address that so that they can be affordable, so that healthcare can be universal. And thirdly, we want to make sure that we take steps by educating the people and other things to make sure that they take care of themselves so that we can reduce the instances of obesity, diabetes, and the other chronic illnesses that unfortunately we lead on in Bermuda that have a large impact on our society, on our healthcare costs, and the day-to-day well-being of our individual community members.
And so why is it important that just that everybody looks at this problem and not just government? Because initially it used to be just government thing, and now you're asking everybody to get involved.
Absolutely, because like I said, it impacts every individual. Everybody either personally knows somebody that is struggling with diabetes, if not them themselves, or a chronic illness that relates specifically to health, their lifestyle. Obesity affects obesity and or being overweight affects 3/4 of Bermudian adult population. It's staggering statistics. We are one of the highest levels of individuals with obesity and overweight in the OECD. It obviously impacts tremendously on our healthcare costs because people that have obesity or overweight generally have a number of other health complications that increases the trips to the doctor, trips to the hospital, medication. It all impacts adversely, unfortunately, on our rising healthcare cost.
So if you could expand more on the healthcare costs and how it really is affecting, as you said, the overall picture, if you could talk more about that.
Certainly. Healthcare costs are based basically on utilization. Every time you go to the doctor or you end up in the hospital, there's a cost to the system with respect to the healthcare costs. Individuals that generally suffer from obesity and are overweight, as I indicated, oftentimes have many, many other health complications with chronic diseases, diabetes, and the like. And when they enter into the hospital, there's a fee associated, which you and I are paying for. If they go to the doctor, there's a fees associated with that as well. So in addition, we are living longer. So we have a sicker population that are living longer, which creates even more complications as it relates to our healthcare dollars.
All right, I'm going to bring in Mr. Kendall. You are the
Director, Department of Health.
All right. So recently there was a symposium. We had a symposium, and so I wanted you to talk to us about what the symposium was for and what results were garnered from that symposium.
Sure. So the symposium's intent, the desired results, come up with a national plan to halt the rise in obesity and diabetes in Bermuda. And it was a way to convene all sectors of all society and actually have them make a commitment from their organizations and what they could do. We also want individuals, but this particularly was about stakeholders from community groups, from unions, from education, from agriculture, from transport, from the food sector, from business, et cetera, et cetera. We want all of Bermuda engaged. So the symposium was based upon a framework, which is, it was a matrix actually, and what we used was the disease continuum, because, well, whether people realize it or not, you often start life very healthy, but then you can kind of, unless you have a plan and you are trying to optimize your health, which few of us are, you will slide into disease, especially in the obesogenic environment that Bermuda is. So on that kind of, we don't want people just sliding, so we've identified that there's these different like firewalls or checkpoints where we can actually have interventions. And the first category along this disease continuum is healthy people. So what we want with our healthy population is to maintain them as healthy people and promote health. Now, there's very few people we know from our STEP survey that are actually have no risks. There's only 3% of our population. So 97% of our population actually has these risk factors. 2 of them are non-modifiable risk factors. So we have an aging population, and we're told that by the statisticians that over 50% of our population is over the age of 45. So in fact, 50% of our population has a non-modifiable risk factor, which is we're older. Second one is family history. So again, 50% of our population has some kind of family history of a chronic disease, whether it's diabetes or cancer or something like that. So they're at risk as well. So that's really setting up something that's an at-risk population just in itself. And then on top of that, we layer what we think of as 5 modifiable risk factors. So it's a sedentary lifestyle, not moving enough, not getting, if you're an adult, not getting 20 minutes of exercise or activity per day. The second one is that we're overweight or obese, and that's preventable. The second one is smoking, so tobacco use. The next one is immoderate use of alcohol. Alcohol is one of the risk factors, is very important, and we hope to be addressing that more. And the last one, and very, very important one, I've probably left the most important for last, is unhealthy diets. So these are diets that are high in salt, high in sugar, high in fat, high in calories. So we need to get people to be eating more fresh fruit and vegetables. And we have the healthy plate. And the idea is that you put half of your plate, I haven't yet seen many Bermudians with half their plate vegetables, but the idea is it displaces the other less wholesome foods off the plate.
Meaning the meats and the starches. Yeah.
Yes.
Yeah, okay.
So I'm only really at the start, but these are I've just explained all the risk factors. So this was the second stage on the disease continuum. So what we're trying to do is reduce those risks to the population. Now we get to the next stage, which is people who actually have signs of a development of a chronic disease. And we don't often feel ill, but we may actually, if we go through a health screening or we go to our doctor annually, they'll do some testing and they'll get some lab results, and then they'll say, hey, your blood pressure is maybe a little bit too high, or your blood sugar is a bit too high, maybe you've got a few extra pounds, okay? So that's another kind of checkpoint that we have there. And if we then continue to maybe not address that, and we still haven't had the wake-up call and are not striving for optimal health, then we'll start to get symptoms of a chronic disease. So you may get thirsty all the time. This is one of the signs that maybe you're starting to have diabetes, onset of diabetes. You maybe have frequent urination, et cetera, et cetera. You may start losing feeling in your feet or something. And that's even before you've been diagnosed. So that's another checkpoint. The next one is obviously a diagnosis, and then even after a diagnosis of disease, you then may even go into a complex disease state. This is somebody who's already, say, got diabetes. Now they're having kidney failure. Maybe they're having amputations. Maybe they're going blind. So we don't want to wait until we're way down the end, because the next step is dying, actually. But we want to make sure that in the strategic plan that we have checkpoints all the way along. So this is helpful for people who are working with really sick populations. They can actually try to do case management and make sure that those people are looked after as well as possible, so they don't go blind, so they don't need dialysis, so they don't need all those other complications. They don't have to happen. The going upstream again, you know, if you have a diagnosis and you're on medications, are you being well managed, and so on and so forth, all the way upstream. We want to make sure all those checkpoints are are in place.
Okay.
Yeah.
I liked how you said that it's important to have that yearly screening with your doctor to offset anything, because a lot of people just say, like you said, everybody's feeling well, I don't need to go, but it's important that you do what you have to do to care for yourself.
Yeah, and we've had this discussion before. Men frequently
Right.
are the culprits that don't go to their doctors annually. We're trying to encourage everybody to, when I said making a plan, it really is not making a plan in isolation. It is actually consulting with other people, like healthcare professionals, and seeking advice, their advice and help. And we're also we're looking for different types of interventions where people work as groups. So there's a lot of lifestyle intervention programs now where there's people who really want to go to a better place with their health. They can actually get lifestyle counseling, which is not just do this, but actually have a plan where somebody shows them what to cook, how to cook it, and starts to change their lifestyle. So we're not talking about diets, we're talking about change in lifestyle, changing how you live from day to day.
Okay, very good. So it appears that the Premier is making this a priority in his administration, and if I can read a quote, he said, if I only had one New Year's wish, it would be for us as Bermudians to focus on becoming a healthier community. We must become more conscious of what we eat and the importance of exercise. Can you give us your take on this statement?
Well, for me, the key word in there is community. So, the vision for the Ministry of Health is healthy people and healthy communities. And I think it's just natural that we often are centric, we think of ourselves. But really, if you are lucky enough to live in a healthy community, you will be healthy yourself. You'll just be a reflection of that community. So what we're trying to do is get all of the communities that exist in Bermuda, whether it's clubs or whether it's schools or all these little church communities, even neighborhoods, workplaces, that's a workplace community, to actually make this a priority. So yeah, we sit down in our meetings and we talk about all sorts of social things, but is wellness on the agenda? Are we as a community striving for wellness? So that's what we want. We want it to be a priority in 2018 for everybody to have that as an agenda item and say, what are we doing for each other in our communities to actually help each other all be healthier?
Very good. And so he went on to say that we will definitely be hearing this message over and over again, and that the government will lead by example. Can you give us some examples of how the government will be leading?
So on Sunday, can I say the date?
Go ahead.
It doesn't matter.
Yeah.
Okay. Well, so one good example is the 100 Million Steps Challenge. This will be launched in January of 2018, and it will involve 11 ministries of government, and we're going to be partnering with 11 of the schools in Bermuda, and there's going to be a draw so that each ministry will be paired randomly with a school. But then all the members of that ministry are going to be counting their steps, and what it involves is just taking your smartphone and using an app that may already exist on your smartphone. Some people actually have the little Garmin or Fitbit things, and we have a website, and the idea is to actually be the winning ministry school combination. And in this way, we're hoping to engage the school community and engage the ministry, the people in the department or departments within the ministries will all be vying against each other to actually walk the most steps. And this is kind of an expansion of something we've already done very successfully. It will culminate in Public Health Week, the winning school ministry combination. There'll be a presentation to the school of a $5,000 prize.
Okay,
Yeah.
that's a good initiative. So it talked about 11 schools. How come just 11 when we have so many more schools? Or?
I think it's the middle schools
Oh,
that we're targeting in particular. Is that correct? No. Sorry. I have to
Okay.
check.
It's probably because there's 11 ministries. So we're trying to tie the ministries to,
with the
in
schools.
keeping with the government's commitment to lead from the front with respect to health. We want every ministry to actually be targeted with the schools.
And
trained.
so how are you deciding which school is going to be participating in this?
I think it's the 11 high schools and the middle schools. I think that's what it ends up being when you add them up. I'm sorry, I don't have the sheet in front of me.
Okay.
So I'm kind of drawing a blank a bit about that.
Okay. So the big thing in the news has been about the sugar tax.
Yeah.
That's been a big thing. Do you think this is really going to work with our community?
Well, Ms. Burgess, as was indicated in the throne speech, the government indicated that we would be commencing the consultation process for the review of an implementation of a sugar tax. We've seen in many other jurisdictions the success, and that the consumption rates with respect to sugary products does decrease with the introduction of a sugary tax. One of the surveys that was conducted in 2014, the STEP survey, which Mr. Kendall spoke about a few moments ago, revealed that over 50% of adults drink at least one sugary soda a day. 34% drink 2 or 3, and 16% drink 3. And we recognize that sugar has absolutely no nutritional value. Soda, or cola soda, consumed has more sugar in it than your daily allowance. So at the end of the day, we recognize that sugar does cause persons to be overweight and obese. And again, it is has found major success in a number of other jurisdictions. And the consultation process just commenced. It's scheduled to continue until the 1st of March. And we're looking forward to reviewing the submissions that are made by members of the public. We invite everyone to participate in the consultation process. However, it is something very important that needs to be considered, which we're doing.
I think we also need to look at the calories. So the minister mentioned the STEP survey results, and that we do have a population that drinks soda. Every time you drink a soda, you're getting an additional, in the ballpark of 235 calories added to your daily allowance. So my own allowance for calories is, say, 2,000, because I'm an active middle-aged man, I suppose. But that's 10% of my daily allowance of calories. So if I drink 2 sodas, now I'm up over 470 calories. So now I'm 20%. Now if I am drinking 20% excess of my daily calories every day, it doesn't seem like a lot. Oh, it's only 20%. But if you add that up over a year, I will start to pack on the pounds, and then I'll become overweight and obese. So sodas are generally making our population fat.
What are those wasted calories? There was a term for it, I can't think of it right now, where it's just not really making sense to your diet. Like you said, you're just drinking, and then you have your other foods to consider. And so those are just calories that are just putting on and not really getting any
nutritive
value.
That's great.
Yeah. One of the things I've been using is, the thing that makes your water kind of spark, like Perrier water, so that you can get the soda feel, but not the calories. So that works for me.
Well, we're actually asking people to choose water. So
yeah, I do use the water.
I mean, I drink water, and I actually just squeeze a little bit of lemon into
lime,
it.
Yeah, it makes a huge difference. It really, really does. So how will we know when Bermuda has halted its obesity? How are you going to measure this?
So the minister mentioned the STEP survey in 2014. That was like a health census where we had health teams knocking on doors. We did a randomized survey through the stats. That is our kind of our best yardstick, because a lot of the surveys that we do are just phone calls, and we ask people to self-report. That will be repeated in 2019, that STEP survey. But beyond that, we do actually have the phone call surveys, and we actually keep our stats updated very regularly. There was just a report put out last year. It's called Health and Review 2017, so that gets updated every 5 years or so. That's a very important measure. One of the things that we are going to be doing is advocating for the National Plan and Oversight Committee, and they will be looking at all of the commitments that were made and ensuring that they are implemented and helping to implement them. And they will be reporting back regularly as well.
Okay. Minister, back to you. I wanted to ask about, are there any resources for people that really want to commit to change out there? Any resources as far as, I know that we're doing a lot of television programming here, but what other things are going on to help people that really want to make that commitment to change?
Well, one of the things that we're asking the community, as I indicated, it is a community. The community has to be involved in us trying to halt the rise of obesity and diabetes. But we're encouraging physicians to have those conversations, those tough conversations with their patients about being overweight and about looking at their health styles. We're also encouraging through programs that we have within the schools, the Healthy Schools program, to encourage students to choose water and to live a healthier lifestyle. If we can get the message in our younger people, then as adults, it'll obviously be ingrained in them, and it'll be easier for them to refuse to have those sugary substances. In addition to that, the ministry sponsors Taking It to the Street initiatives, where we go out into the community and test for blood sugar, blood pressure. We want to encourage people to know their numbers, because obviously if they see that there's some issues that are being identified through these Taken to the Streets initiatives, then we encourage them go to a doctor and have that regular checkup so that you can ensure that your numbers are in line with what is normal and healthy.
Well, I can assure you that the water only in schools is definitely out there. I can assure you that. In fact, so much so that if children bring anything else like the little drink boxes, it's a no-no. So they will have to take that back and drink some water. That's how serious the schools are.
Yes.
Can I mention one other?
Sure, sure. Please.
That was the Grow, Eat, Save program. It's been very popular. We've had it for 2 rounds so far. In 2018, we'll be having it again. What it involves is we have Reverend Santucci, Chaplain Santucci, and he has been teaching Bermudians how to grow their own vegetables. So sometimes you can see cauliflower, like cauliflower, $9 in the store, but this you can produce your own fruits and vegetables. And so we actually it's snowballing. So we've got private companies helping us out now. We actually have the Parks Department is helping us, and also other entrepreneurs have all chipped in. There was land now, so each person can have an allotment which they can farm, and it's somewhere in Devonshire, secret location, but it exists and it's really going well.
Yeah, there's a lot of things people can do. You mentioned cauliflower, and I know a lot of people like mashed potatoes. Well, guess what? You can boil the cauliflower and use a little bit of olive oil and make it and mash it up, and it's the same effect. So little things that you can do. But let's be real. It's going to be daunting for a lot of people to really, really make this change. What assistance can you give to those people that are saying, this is difficult because they were brought up on a high-calorie diet? What can I do? What can you do to assist these individuals?
So the part of what we need to do is we need the health system and also other people to address that. We're looking for many more of these lifestyle intervention programs that I mentioned. It really is not going to be easy for people to change their lifestyles. We understand that. And people need to have a plan. They need to actually have help and they need to plan out their meals. They need to plan out their activity. It really can't just be, wake up in the morning and I'll just kind of do it as I get to it. It has to be a lot more planning involved. We actually, what's that expression?
It's true. Yeah, because like I know throughout the week, like Monday, Wednesday, and Friday, for me, I'll be working on legs, and Tuesday and Thursday, I'll be working on arms, and every day I do abs. So it's just something as simple as that, and the planning of your meals makes a big, big difference as well. So yeah, I understand that.
Otherwise, people will be getting the fast food and the high calories.
It's simpler.
Yeah.
It is simpler, but I'll be honest, you know, when you do make your own food, you know what you're putting into it, the seasonings you're putting into it, as opposed to going out to the fast food, because you really don't know, you know, how they're preserving that food.
People need to look out for the number of the lifestyle intervention programs that are coming up in the community. There's more and more, and I'm not going to name any because people may say I'm playing favorites, but they do exist, and they're becoming more prevalent. And really seek the help of those that will really help you do a reset on your lifestyle.
Yeah, and like salt, you should not be putting additional salt on your foods. Just little simple things like that make a big, big difference. Minister, back to you. We wanted to talk about the national strategy. You mentioned it already, but what will the other ministries be doing to assist in helping the whole community, as you say, to get healthy?
Excuse me. Some of the initiatives that we spoke about before all deal with cross ministries. So, for example, the introduction or the consideration of the sugar tax will involve both the Ministry of Finance as well as the Ministry of Health. The Ministry of Education is involved with the Healthy Schools programs. The Ministry of Parks as well. When we previously had a 100 Steps Challenge, the winner of that challenge received park equipment. So there's the synergy between health and the Parks Ministry, the Parks Department. So there is a number of synergies involving all the ministries, and it's touching. And because it touches every community, it's obviously going to touch every ministry as well.
All right, so I wanted us to look at the PYFP. Are you familiar with that? The Premier
Youth Fitness Program.
Oh,
yes.
right,
Can you
okay.
talk about that for us?
Yeah, absolutely. So, well, we're working with the PE teachers in particular in the schools, and every school has been every PE teacher has been given these heart rate monitors for their PE classes. What this makes, it gives the kids instant feedback, whether when they're doing their PE classes,
Right.
that they're actually keeping in this heart rate, which is giving them an optimal benefit. It's to assure that some gym classes aren't just sitting around and that they're not actually moving as much as they do. But beyond that, that was kind of like a tweak that we added last year. We're looking at 5 different measures for all school kids. So we're looking at upper body strength, we're looking at aerobic capacity, body composition, which is their BMI, so that's their height to their weight, core strength, and also flexibility. So there's a standard way through a fitnessgram to measure this, and so there's twice a year measures being done on the school population as they go through school. So what we're trying to assure is that as our children go through school, not only are they getting smarter and becoming better academically, but also they're becoming fitter. We don't want our kids to go through school and actually come out and graduate in worse shape physically than when they went in. It's illogical, and we shouldn't be doing. We shouldn't be doing that. We should just be aspiring for optimal health for them. So really, we're trying to set up that feedback mechanism at an early age where kids aspire to health and know their numbers and kind of have something to strive for.
That would make a big difference because the gadget, I haven't seen it yet, but you say everyone has it?
Yeah, it's like
The
an
children?
Adidas watch, and they haven't been issued them personally, but the PE teachers have them for all of their classes.
Okay,
Yeah.
and so the children will be able to read their numbers and
Yeah.
get to understand that. So
Yes.
that would make a big difference. Okay.
And we also, as part of that, we can identify any of the children that may be at risk, and without any stigma attached, able to assist them, either giving them and their families or whatever is most relevant, counseling and help in order to adopt a healthier lifestyle.
All right. Well, we're almost finished. I just want to get any final words from you, Minister, and then we'll pass it on to you.
Okay. Well, again, thank you for allowing us to spread the word. And I think the final message I'd like to leave with everyone is recognizing that it's imperative that we, for a number of reasons that we've discussed already, that we halt the rise of obesity and diabetes. And in order to do it, it's a community effort. It takes all of us to do our part, and it will eventually assist us tremendously as it relates to healthier populations, so we have better health outcomes, help to reduce the cost of health care, which again is staggering and unsustainable, and it will allow us all to lead more healthier longevity lifestyles so that we can be productive members of our community.
Yeah, nicely said.
Thank you.
Yeah, we are the Department of Health. We actually don't want to be the Department of Illness. We want people to thrive. We want people to get the most out of their lives. We want them to feel good internally and feel good about themselves. And we want to give them the tools to do that from the earliest age and to maintain their health. So this is a very important part is these chronic diseases. The world is grappling with chronic diseases. Unfortunately, as human beings, we respond very well to a crisis like Ebola or something that we think is going to like strike us down like this. But when it's something that is just a chronic disease, which is just gradually creeping, and our health is sliding away and we're sliding to illness, we don't respond as well. So we really want Bermuda to wake up and understand the severity and importance of this, and that it's preventable, that we can do something about it. This is not something that's inevitable at all. We just need to roll up our sleeves and really put this as a high on our priority list, that we aspire for health and to strive for and achieve it.
All right. Thank you, Minister, as well as Mr. David Kendall. Today I've been talking about the public health crisis of diabetes and obesity and how all of Bermuda must take an interest in halting this alarming trend. I'd like to thank the Minister of Health, the Honorable Kim Wilson, and the Director of the Department of Health, Mr. David Kendall, for joining me in studio. Until next time, I'm Shay Burgess. Thanks for watching Health and Family.